Hello, AP Psychology students. This is Mrs. Politsky, and I have your short answer questions for Chapter 12. So here we go. Number one, distinguish between a hallucination and a delusion. And accordingly, a hallucination is a perception that occurs in the absence of a stimulus. In other words, somebody is hearing something, but there's no sound. Or someone is saying that they're seeing something and there is nothing to be seen. Whereas a delusion is just a false belief system, meaning that you think something is such a way, even though there's a lot of research that says otherwise. And number two, when a person makes people uncomfortable by making them feel threatened or distressed in some way, this is an indicator of an abnormality that is called observer discomfort. Number three, which book published by the APA classifies mental disorders by their symptoms? And that would be the Diagnostic and Statistic Manual of Disorders, and that would be the 5th edition, or AKA the DSM. Number four, name 3 mood disorders. Okay. You could have, a lot of times when we think about mood disorders, we think about um, things such as depression, bipolar disorder, major depression, or seasonal affective disorder. Number five, what mood disorder often affects people in the winter? And what is the biological explanation for this illness? Well, that would be the seasonal affective disorder, or AKA SAD. And a lot of it has to do with irregular levels of melatonin in the body. In other words, because of the lack of sunlight, your body isn't producing adequate amounts of melatonin, and hence you feel sad or depressed. Number six, briefly explain what happens when one is suffering from a panic disorder and compare this to generalized anxiety disorder. Well, panic disorders, for the most part, or a panic attack, with no connection to a present situation. In other words, um, a person is feeling like shortness of breath or a tightening of their chest, like they're having maybe, a heart attack. Um, Eventually, this panic attack will subdue, but generalized anxiety disorder remains indefinite. In other words, they constantly are living with this anxiety, the feelings of um, panic or this dread that they may be dealing with, that they really can't put a finger on, as far as where it's really coming from. Number seven, the blank hypothesis, or the preparedness hypothesis, suggests that we carry around an evolutionary tendency to respond quickly to stimuli that our ancestors once feared. And number eight, how are obsessions and compulsions different? Okay, obsessions are thoughts, and compulsions are actions. So uh, when you are obsessing over something, you're constantly thinking and have thoughts about this item or person or such. A compulsion is like you're actually doing something. So a lot of times when people think about like OCD, um, the C part, the compulsion, is the action. So it could be, being compulsive cleaners or something of that nature. And number nine, if someone believes that they have a very little bug that is going around, even though there is no physical indication that they are sick, they may suffer from, let's see, hypochondria. This idea that a person could be perfectly healthy, but feel like or they think that they are ill or that they have contracted a major disease or such. And for the most part, it's not necessarily something that is based on any physical symptoms. Is probably more of a psychological issue. And number 10, the famous cases portrayed in the movie Sybil and the Three Faces of Eve depict patients with dissociative identity disorder, or DID. Sometimes it used to be known as multiple personalities. Number 11, how do bulimics lose or maintain their body weight? And that is through the idea of binging and purging. Binging meaning like you eat whatever you want to eat, in some cases overeating. Purging is the elimination of that, and that can be in the form of vomiting or through other means. Number 12, describe 2 facts that support the notion that schizophrenia has a biological basis. And let's see, brain pathology is probably best bet here. People have gone back and they've done research on individuals who have had schizophrenia, and they have looked at a couple different things. One, the antipsychotic drugs that can block the dopamine receptors, and as a result of that, that might maybe not necessarily get rid of all the symptoms of schizophrenia, but it certainly makes them a little bit more manageable. And the other is the twin studies of schizophrenia. It typically looks like if one twin uh, has schizophrenia, that there's a much higher probability of the other twin having it as well. And number 13 briefly lists 3 characteristics of an individual with an antisocial personality disorder. And a few of these are irresponsible behavior, harmful behavior, primarily towards themselves or others, and a lack of conscience, meaning like doesn't matter, they don't really feel like they're responsible for their actions. They might lie about what they have done. So these are all examples of antisocial personality disorders. Number 14, what is the main problem for those suffering from dyslexia? And we can move this. It is primarily troubles with being able to read. There's a lot of research going into brain theory about dyslexia, and we're kind of pinpointing the different regions of the brain that are involved in helping people understand the words that are on a piece of paper. We're also learning a lot about certain colors that make it easier for people who are dyslexics to be able to read. And in some cases, we're using colored paper or certain tinted lenses to help dyslexics be able to read better. And number 15, what does insanity actually mean? Well, insanity is more of a legal term. Matter of fact, in the world of psychology, we really don't even think about this concept of insanity. But in terms of the courts, they really do look at this. And it's a legal term referring to whether one who might not be able to control their own behavior. And this gets into the issues of whether or not a person who commits a certain act that is kind of violent or irresponsible, whether or not they can say that they were really aware or responsible of what they were doing. And in some cases, that might mean a person uh, gets off the hook for their behavior and for the things that they have done. That has to be proven, and hence that's not always an easy thing to do. But people who are declared insane usually have to go through a battery of psychological testing to prove that. All right. Thank you very much.